Hello friends, welcome to ACJ Tutorials. Hi, my name is Harindar Singh and I'm an internationally trained dentist from India. I hope if you are watching this video, you are interested in or you are appearing for the assessment of clinical judgment exam, which is second part of the equivalency process to practice as a dentist in Canada. So my friends, the ACJ stands for Assessment of Clinical Judgment. My purpose of making this video is for those people who don't have access to or who don't have enough money to enroll themselves into the coachings that are available in Canada. I myself took coaching for this exam and I have realized that though the coachings are good, but they take a lot of money from the students and not everyone can pay that money very easily. So I hope my tutorials will help you to ensure success in your assessment of clinical judgment exam. This exam consists of two portions. First is clinical cases portion and the second is radiograph part. In the clinical cases portion, we are presented with different clinical scenarios and we are given patient history along with clinical symptoms, medical history, previous medical or dental history, and radiographs related to the subject in question. In the clinical cases portion, we have various different aspects to look at. First is emergency, then comes the patient management, then we have pharma, exo, local anesthesia, operative, endo, various diagnostic tools that we use to come to a particular diagnosis, then we have ortho, then perio. In the radiographic part, we have to judge based on bite wings, periapicals, and panoramic x-rays. Let us now discuss the pattern of this exam. This exam, it constitutes around 130 to 150 questions. This exam is a one-day exam, unlike the ACS exam, which is a two-day exam. This exam is a multiple choice based question answer exam, and each question has multiple options and the options have partial marks. Let's say a question has 7 options: A, B, C, D, E, F, G and H. So out of these 7 options, maybe 2 or 3 answers are right, but they have partial marks. For example, A carries 0.3 marks, D carries 0.2 marks and F carries 0.5 marks. So in total, the answers are A, D and F. But there might be some other options that are neutral. For example, B and C, these have 0 marks. And the rest of the 3 options, these are negative marking options, -1 and -1. So let's say you choose A, B and C option. A, B and C. 0.3 plus 0 plus 0. It comes out to be 0.3 marks. But in case you choose A, D, F and G. A, D, F and G. Your marks comes out to be 0.3 plus 0.2 plus 0.5 plus -1. This means your overall answer is 0. So in this exam, you have to get yourself away from the minus options. So I just want to tell you that this exam is not like AFK exam, which does not have any negative marking. This negative marking is the reason why this exam has become so hard. Earlier days, it was considered to be the easiest exam, but now this is not anymore. This exam is now as tough as other exams are. Let us now discuss about a very important part of this exam, which is the main reason why some of the students, they're not able to clear it even in the third and last attempt. This is my opinion, my friends, but I have found that this is a very important part. If you really concentrate over it, you might be able to look at your flaws or maybe some of your reasons why you could not clear your exam in your attempt. So let us now discuss the various approaches that students take for this exam. So I have made 4 approaches for this exam. The first one is undermarking. As it's clear from the name, undermarking means you knew the answers. You knew that there are 4 right answers. Since you studied and you knew that these 4 answers are right, but somehow in the exam you got scared and you thought, what if I choose 4 options and the examiner has only marked 3 options as right? So I should not be choosing all of the options. Let's choose only the most important one. If you do your exam like that, you might be losing 0.2 or 0.3 marks in every question. So in the end, you'll end up losing a lot of marks. So this means even if you knew all of the answers, but still you did not choose all of the right answers, and this type of approach is called undermarking. The second approach, it is called overmarking. There are certain type of students who think that a lot of answers may be right, so I should be choosing each and every right answer. So what they do is, even if the things they don't fall into their 100% into their concepts, but still somehow they take more risk and they tend to choose each and every option that they feel that we have a gut feeling for that. They choose all the options. So sometimes when you have a habit of choosing all the options, even if you're not 100% sure, you end up losing your marks because somehow you may be choosing negative marking answers as well. This type of approach either takes you to a very high marks or it takes you to less than 75 percentile of marks. That means you could not clear the exam. So this type of approach is called overmarking. The third type of approach is aggressive. So if you have a habit of overmarking throughout whole of the exam, this type of approach is called aggressive approach. Since this exam has a negative marking in it, so aggressive approach, in my opinion, is not good. Because if you want to ensure your success, the aggressive approach might end you up in 70, 72 or 73 range of percentile. So the best approach that I had used myself and that I recommend to all of my friends who ask me about how I could pass the exam, the fourth approach is conservative approach. Some people, they get they have certain doubt about this conservative approach. They think that conservative means you should mark only that option which you are 100% sure about, and you should not be marking all of the options even if you know them. No, my friends, only one part of this thing is right, that you should be marking only those options that you are 100% right. But in a given question, if you have 8 options and you are sure about 5 of them to be right, and the things they fall 100% into your concepts, you should be marking each and every option. Since you work hard for around 2 to 3 months to make your concepts, so now you know it works mostly in your x-rays, that when you know that there are caries or bone loss or anatomic features that they have asked in question, and you know them that those things are present and the things are directly within your concepts, you are not scared to choose all of them. So that type of approach is called conservative approach. So my friends, I suggest always go with the conservative approach, because when you know that things that you know are 100% right according to you, only then you are choosing the option. This will help you in making most of the questions right. For example, if you have 130 questions in your exam, even if you are getting partial marks out of most of the questions, and your questions are not at all getting wrong, you will definitely end up in the passing zone. So my friends, I suggest you go for conservative approach. Don't go with undermarking, overmarking or aggressive approach. So friends, now you know the basic of the ACJ exam and the approach towards the exam. So in the next tutorial, I'll be starting with the pharmacology, and from pharmacology, I'll be starting with the antibiotics. So I'll take your leave now, but please don't forget to subscribe my channel and press the bell icon so that you get updated with my new videos. Thank you very much. Bye.